Hello, I'm Dr. Paul Mead. I'm an orthopedic surgeon specializing in hip and knee replacement. So hip pain is a very common thing I see. I like to start with easy, minimally invasive things that we can do to help minimize the pain. If those treatments no longer work, I like to have a very frank and open discussion about surgery. I try to be as minimally invasive as possible with surgery. I've gone through extensive training to do the most advanced techniques that are currently out there. I think a lot about an individual approach to each patient and make sure that the implant choice, the surgery, and the treatment is all customized to you. What I love about being an orthopedic surgeon is the first post-op visit for a majority of my patients. That time when they come back and they say it was all worth it, or that time that they come back and they say, I can now play with my grandchildren again, I can garden, I can do the things I was never able to do before the surgery. If you have hip or knee arthritis, I look forward to taking care of you.